in collaboration with Academy of Nutrition Sciences, is honored to host today's session on the topic Rebuilding Strength, Nutrition After Chemotherapy. As we know, post treatment recovery is a critical phase where the right nutritional interventions can significantly impact a patient's strength, immunity, and overall quality of life. To guide us through this complex subject, we have with us a truly distinguished expert. It is my great pleasure to introduce today's speaker, Dr. Eileen Canday. Dr. Eileen Canday currently serves as the head of the Department of Nutrition and Dietetics at Sir H.N. Reliance Foundation Hospital. A true leader in clinical nutrition, she is also the founder of the IPEN India Nutrition and Transplant Core Group. Her expertise is globally recognized with specialized certification from ESPEN, the European Society for Clinical Nutrition and Metabolism, Monash University, Australia for IBS, Diabetic Educator, the International Diabetes Federation, Body Composition Analyst. Beyond her roles as a pediatric onco-nutritionist and nutrigenetic counselor, Dr. Canday is a prolific author, researcher, and academician. We are incredibly fortunate to have such a wealth of knowledge with us today. On behalf of Goa College of Home Science and the Nutrition Society of India Goa chapter, the principal, the convener, local executive committee, and the members, I would like to extend a warm welcome to you, Dr. Eileen Canday, and to all our online participants.
Thank you, Molita, and thank you, Varsha. It's really been a privilege to be on this platform today and, collaborate with you for such an important topic. I have one request from the participants that you all can put your questions in the chat box when you have the questions. After the entire lecture, I will reply to your questions. Yeah, just give me a minute to share my screen.
Hi, today we are going to talk of rebuilding strength, nutrition after chemotherapy. Chemotherapy is a life-saving treatment used to destroy the rapidly dividing cancer cell. However, it also affects the healthy cells. And today we're going to talk in detail about how nutrition can be helpful. I'm Dr. Eileen Canday, and today we're going to speak a little bit about nutrition and chemotherapy. So chemotherapy remains one of the most powerful weapons in fighting against cancer, but it also extend far beyond the targeted malignant cells. So the drugs that are designed to destroy the rapidly dividing cells, yet they also affect the healthy and rapidly dividing cells in the gastrointestinal tract, bone marrow, hair follicles, and also the immune system. So for millions of patients worldwide, this treatment journey begins profound with a lot of nutritional challenges. Appetite may decline, taste perceptions may change, nausea, vomiting, digestion, and simultaneously, the inflammation and metabolic stress increases the body's protein and energy requirement. Muscle mass may also decrease and fatigue becomes persistent. So when we are talking about challenges, let us understand a little bit more. So whilst we look at the collateral damage that triggers a cascade of debilitating side effects that profoundly impact the patient, these effects are both physiological as well as metabolic. Now, talking about the major nutritional impact after symptoms, that is fatigue and exhaustion. So one of the most commonly reported side effects is fatigue and exhaustion, and severe fatigue can make even doing normal basic things very, very difficult, like, going for grocery shopping, cooking, or even eating may feel just overwhelming. and there could be a reduced, intake of food, which will lead to muscle depletion. Some patients, in fact, this symptoms is very, very commonly reported. That is, there is persistent nausea and vomiting, and they may occur during the treatment, or even it may continue even days after the chemo cycle is over. So this repeated nausea and vomiting creates a very strong food aversion and conditioned taste response, making the patient reluctant to even eat, even if there are no symptoms. The third and the other important aspect for food is the appetite suppression, where patients face anorexia. That is, chemotherapy does alter the inflammatory pathways and the hunger signaling hormones such as ghrelin and leptin. And this may result to an experience that is less desire for eating. Over and above, if there is mucositis, dysgeusia, that is altered taste, post the chemotherapy, or impaired nutrient absorption. Some patients may have diarrhea, some may have constipation, some may have off and on diarrhea, constipation. So this is very important to understand, because your quality of life depends upon this. Then comes to the hidden crisis, which we have to as nutritionists and dietitians take a look at, as the malnutrition in cancer patients, and understand it that it is important first of all to diagnose the malnutrition, okay? Because there is compromised immunity, and that's why the infection increases. So in a well-nourished body, the protein micronutrients help to produce immune cells, antibodies, inflammatory mediators that fight the infection. But what happens in a malnourished cancer patient? There is low protein intake, and the bone marrow function is already suppressed by the chemotherapy. There is a white blood cell production which also has decreased, and the wound healing slow. So clinically, what you will observe is there is frequent infection, delayed recovery from minor illnesses. People may get admitted over and over and again. There could be cancer, cachexia, or a severe muscle breakdown, where the patient does not only lose weight but has also other immune and other functions that are affected. Then when their chemotherapy is continuous, they could have a reduced chemotherapy tolerance. That is, the chemotherapy requires physiological resilience, and malnourishment cannot tolerate the full drug dose. They experience severe side effects, they require dose reduction sometimes, and they develop treatment related complications. So these could also lead to a prolonged hospitalization because of the delayed recovery. So these are some of the aspects which we have to keep in mind. So when food becomes the hardest battle, okay, so for many the treatment doesn't end with just the infusion. The real battle begins at the food table, where every bite requires courage, and it requires that same desire and love to eat food. So therefore, it is beyond the laboratory values that you have to see. You have to ask, when you're taking a history, you have to ask about mouth ulcers or soreness in the mouth. Is there nausea during the treatment? Is there tastelessness? Or some patients, they complain of metallic taste in the mouth. This is called dysgeusia. And there is this metallic taste also may feel that, okay, they don't want to eat with a steel spoon, because they feel that they're eating, it's like metal in the mouth. So the caregiver here has to understand and address all these emotional distresses, okay? Also that, we cannot just say eat more, eat more, eat more. But sometimes you have to understand that, that there is an experience where the patient is unable to eat because of certain reasons, and you have to respect the food fatigue, the taste changes, okay? You may feel that, okay, the person is unnecessarily talking about the difference in taste. Previously they used to eat better, So these are some of the aspects which you have to remember as a caregiver as well. Now, when food becomes hardest is for many patients, treatment does not end like this. So that's why nutrition matters even more in these situations. It could be just a mucositis which is troubling the patient. So therefore, we have to provide. Now, nutrition role in recovery and strength. So when we talk about nutrition's role in recovery and strength, and we have to look at various aspects, especially the tissue repairs and muscle maintenance, immune system support, energy and quality of life. All these things become very, very important. Also, the connection between nutrition and cancer recovery is very much important, since there are a lot of researches which have been done even in the kind of diet, because most patients who come to me, they will tell me, doctor, give me an anti-inflammatory diet, or what can I eat for this. So when you are looking at chemotherapy patients, you have to understand that chemotherapy increases the systemic inflammation. They do have elevated inflammatory markers. Take a look at the reports. See the C-reactive proteins, okay? The higher the C-reactive protein, the greater is the fatigue, the muscle breakdown is greater. There is poor intolerance to treatment. Try to inculcate your anti-inflammatory foods, the whole grains, fruits, vegetables, nuts, seeds, lean meats, till you find the CRP level reduces. Also, here remember that whilst we are trying to maintain muscle, the critical role of protein is very important in building up the immune system of these patients. So offer them antioxidant rich foods, which has got a cellular protection. Yes, today's day, people are all talking about giving berries, green leafy vegetables, cruciferous vegetables, colorful fruits and vegetables. Yes, it's important to give these things because they do have vitamin C and vitamin E, but remember that you have to also look at the affordability of the patient. Okay, so try to source local sources rather than looking at something that are imported. So if you cannot get blueberries in your local market, just go in for the normal berries which are available. Look out for different colored fruits and vegetables. Remember that the gut microbiome is also disrupted and the intestinal lining gets altered. Okay, so you have to look at the restoration for the gut microbiome, especially patients who are having either diarrhea or constipation. So here you can offer fiber-rich foods. Okay, it could be from any fiber foods like oats, banana. It could be probiotic-rich foods that comes from curds, yogurt, or beneficial bacteria. Also, here in a very, very important aspect is we do not give supplementary probiotics. Okay, we give natural probiotics. One is because the immune system the patient is fighting, and we don't want to give live bacteria from outside. We want the bacteria and the gut itself to be reduced. Talking again about anti-inflammatory food, look at the omega-3 fatty acid in the diet. If the patient is not eating fatty fish, try to offer flax seeds, walnuts, which will help the patient to get natural sources of omega-3. These are some of the important aspects. So remember that recovery is not a straight line. Okay, so it is very rare that you will have a very smooth and a predictable recovery. So I find patients who come to me before the chemotherapy starts, they're able to manage, their weight and manage their weight even through the chemotherapy. But people who have already lost like 5-10 kgs and then they come to me for a diet, they are more difficult to get back to their status. So remember that when we are looking at chemotherapy, we try to tell the patients to come to us as earliest as possible so that we are able to adjust the textures. Sometimes maybe because of the mouth sores they are not able to eat, and then instead of just saying, oh, don't eat anything or just drink liquids, they just drink soups and kanjis the whole day. I would say that let's adjust the texture of the food because you have a mouth sore. It's not a very big illness that You have to lose weight for that. It's not something that you cannot eat at all. You can eat. If you change the texture of the food, you can eat. Sometimes only changing the temperature of the food also makes the patient eat. So we have to individually look at what the patient is challenges the patient is facing. So encourage them to eat when they are hungry in that eating window. And sometimes some patients can focus on small volumes. Also remember, hydration is important. So fluid space throughout the day can prevent dehydration, especially when there is nausea. They may not want to drink water also. Okay, so you have to look out for ways and means when you can manage, and you can tell them that okay, before meals you can have this much amount of water, you can have buttermilk, you can have lime water, you can have your, if you want to have some drink like a lassi or something which makes you feel better, that helps them to recover, and that fluctuation will be reduced. Also coming to the common side effects, which could be a barrier to chemotherapy, even the post treatment. That is, one is oral complications. Okay, mucositis, xerostomia, and dysphagia. Mouth sores, that is mucositis. Xerostomia is the dryness of the mouth. Okay, or the difficulty in swallowing can make it very, very difficult to eat. So I have patients also with, along with chemotherapy, probably they have done a surgery as well. So they have a very small opening in their mouth. So you have to explain to them how they can consume foods either by a spoon or a straw, whichever suits them better. Okay, so we also find that there could be patients who have got ulcerations or inflammations. Okay, so those are the patients you should say that okay, because they must be used to eating chilies and spicy food earlier. Now suddenly they want to eat it because their mind is saying I want to eat it, but then you have to tell them how they have to manage a very spicy or a very acidic food, like a achar or a pickle. Or they may want to eat some very dry, coarse structured food, like they may not be able to chew well, or they may not have enough of saliva, and they may want to eat like a toast, which on any other situation is fine. But if they are having dryness in the mouth, you cannot give them that kind of food. But somebody else who does not have, they can have it. So you, in these cases, you can recommend a very soft, easy to digest, moisture, non-irritant foods, and encourage them to have little cooler foods, at room temperature. Don't have the hot gravies, broths. Okay, have easy to swallow food. So even when patients have a dysgeusia, that is the altered taste, especially they say that metallic taste or bitter taste, or sometimes they say there is no taste, only they're eating cardboard. Patients come to me and they tell me, doctor, I feel I'm eating cardboard. I don't have any taste. I don't feel like I'm eating food. I'm just swallowing the food. So these are the people who eat with their eyes. They eat with their nose. So give them foods that have got a certain flavor which they like. So sometimes they could have a flavor aversion as well. So give them like a bland, or a food that's looking good, in their plates, not something that they don't want to even look at it. Then how will they eat it? Okay, try to use mild seasonings, use herbs. If a mucositis patient comes, they may say I don't like lemon anymore. I used to eat a lot of lemon, but now I cannot eat. So give them alternatives. Okay, also rotate the protein food so that they don't have that metallic taste in their mouth. Give them like wooden spoons to eat, or something that is non-metallic, which they're able to eat, so that they don't feel that they're eating a metallic food. Also, they could be having anorexia, okay, because there is a lot of physiological and even psychological changes. So there is altered hunger hormones. There is a change in the ghrelin and leptin imbalance. There is an increased inflammatory cytokines. There is delayed gastric emptying. So these are happening to them, and therefore they may feel like, sometimes because of all these things, they do feel depressed and anxious. They do come, even they even cry that they cannot eat. So you have to be the point of contact for encouraging them to eat small frequent meals. See that if they're eating small meals, that is calorie dense meals. Even it has to be protein dense meal, even if it is a small portion. Okay, so in small amounts, they're getting good amount of calories. Because if they are in cancer cachexia, it is a complex metabolic syndrome, and it is characterized with a progressive skeletal muscle loss. And this cannot be fully reversed because there is a medical aspect to it. But whatever you can do through your food, you should be able to do that. Also, coming to strategies that you can manage these side effects. Okay, give them easy to chew, easy to swallow, non-painful foods. Like if you'd ask me, what will you give it to them? So I'll say, okay, you can offer them different yogurts, maybe fruit yogurt. Crush the fruit in the yogurt, give them curds. Some people like to have mashed potato, so I will grate some, say, paneer in the mashed potato, or oatmeals, or smooth custards, puddings, soft soups. Even if they eat eggs, they can have an egg pudding. Like, just mix the egg with a little bit of milk, and you can either bake it or you can cook it on a slow fire. They may complain of, not able to tolerate sour foods like tomatoes and etc., like, spicy food. So support them by giving them different recipes which will manage these things. So tell them that some people are okay with eating small frequent meals. Some people may say, okay, I'm just okay when I eat a dry cracker or a toast in the morning, then I don't feel nausea and vomiting. You have to talk to them and see what is their way forward. It has been seen that it's a little bit of ginger does prevent that nausea feeling. So ask them if they want to have a ginger shot, or they want to just add some ginger water, whether that makes them feel good. Also, with the temperature of the food is important here. Sometimes very strong smells, they could trigger a negative aspect to eating food. So those can be prevented. These all are very important. Also, because of nausea, not drinking water could be one problem. So tell them how they can, make their water more tasty. Not by adding sugar in it, but by adding some herbs or some teas or some chicken broth or coconut water, or something that's just crushed fruits with, a little bit of buttermilk. It tastes very good. So give them recipes because they can't think, the way you can think, to give them ideas of how they can hydrate themselves while not having things that are not allowed for them, like cola drinks, or drinks that have got excessive amount of sugar, or flavors, or even nowadays even jaljeera is artificially flavored. So try to give them like normal jeera drink. This could help them. And integrate texture, sensory adjustments, the frequency of the meal, optimize their hydration, and enhance their flavor. These are some of the things you can do to help your chemotherapy patients. Okay, so what you build a post chemotherapy nutritional plan. Okay, how will you do that? It has to be scientific. Okay, it has to make them recover, it has to help their symptoms, and you should be able to give them adequate energy, adequate protein, and anti-inflammation. Means, as a dietitian, as a nutritionist, you have to keep so many things in your mind when you're planning the diet. You don't only have to give a diet, but you have to give them a recovery pathway. So whether it's micronutrients, whether it is your gut restoration, this has to be very gradual, and you have to work closely with the patients who are on chemotherapy. Then what are the 4 pillars of post chemotherapy nutrition? Okay, so let us take a look. One is a protein for repair and muscle preservation. Okay, people will tell you, can I have vegan proteins only? So if the person is only vegan, see, remember, you need all 9 essential amino acids for muscle and tissue building. So see to it that they get from other sources then, so that they are able to build the muscle. So there should be tissue generation, there should be immune system production, help, and you should first of all prevent any further weight loss. Remember, something people will tell you, oh, I'm overweight. No, I tell them this is not the time for you to reduce weight. This is the time for you to recover. So don't feel happy that you have lost 3 to 5 kgs in your chemotherapy. You are losing muscle. So do not lose any weight. You can do weight loss. Let your chemotherapy get over. Let all your treatment get over. Then I will help you weight loss. But don't do any weight loss now. Okay? You can do a fat loss, but that is after you have given adequate amount of protein. How much you need to give? 1.5, 1.2 to 1.5 grams per kg per day and distribute it throughout the day. Don't give everything in one meal. Okay, so that is very important. Also, you can give healthy fats. Okay, so that they are able to get adequate energy. So the first thing that people think, oh, I am sick, I'm going to stop all oils and all ghees and all fats and all fatty foods. No, they need that energy. So plan adequate amount of good amount of fats from the healthy fat sources, nuts, avos, olive oil. So these are giving you healthy fats. So include those in the diet. Also add anti-inflammatory foods. Okay, whether it is colorful fruits and vegetables, omega-6, omega-3 rich foods, vitamins, minerals, phytochemicals from the natural sources. Okay, and restore their gut and hydration. So these are the 4 pillars where you have to give them adequate amount of good amount of nutrition so that they are able to recover fast and they are able to gain their strength. So if these are taken care of, mostly the patients are in a better state. So they will ask you what to avoid. Oh, I have milk. Oh, I have stopped having this. I've stopped having that. Why? Because Instagram post, somebody has told them something, somebody has neighbor has come, or some celebrity is doing something. Don't go by all these things. And when the patients ask me, what do I stop eating in chemotherapy? I tell them there's nothing that you need to stop eating in chemotherapy. You need to eat in chemotherapy. What you need to do is be safe food. Don't go on the road and eat pani puri. Think about your immunity. But you can eat things in your house. The same foods you can make in your house and eat. But eat everything is what I tell them. And eat the right food. So I give them a diet chart in which they can choose the right food, but be careful of foods that have, because you cannot effectively fight bacteria, viruses, fungi. So why induce it in the first place? Okay, and then you give antibiotics and then you will give all those things to treat the bacteria. Rather than that, be clean in the first place. So instead of just because even recovery is very slow. Okay, so you have to give them certain tips for eating safe foods rather than not eating certain foods. Okay, so when you're telling them, say about eggs, tell them don't have half-boiled eggs or don't have runny eggs. Have a fully cooked eggs. So don't stop eating eggs. Similarly, meat. Some will say, oh, I like half-done meat. Don't eat half-done. Eat a full done meat. So they just stop eating meats only. They think that it is something bad. It's not bad. Don't eat raw, uncooked animal products. Okay? Don't eat reheat leftovers just in a microwave and eat it up. Because it does not boil thoroughly at 100 degrees centigrade for at least 4 minutes. So that's when you should be advising them that do not eat leftover food. Do not call food from a restaurant where you don't know the hygiene levels there. You don't know how it has been kept. People ask me one question, can I eat ice cream? Okay. Now, ice cream per se is not a bad food. But how is the ice cream stored? Do you know what is the storage temperature? Do you know in which state this ice cream is coming from? You are eating in Mumbai, you're eating in Goa, you're eating in Pune. It is made in Himachal or in Rajasthan. What is the cold chain that has been maintained? Was it defrosted? Not only for ice cream, it's even for yogurts or anything else. My saying is that you eat food which does not have a risk for infection. Avoid high risk foods. That is, you don't know whether your dairy that you're bringing the paneer from outside, whether it is pasteurized or unpasteurized. Make it at home because you know how you have made it. Now, if you cannot and you know that, okay, this particular dairy is giving me real good, authentic one, I would still say just run it, don't eat it raw. Run it through a heating method. Okay, bake it, grill it, saute it, do something like this. So, especially these soft cheese, unpasteurized milk, you don't know. Also, raw and undercooked seafood. So, especially today, there's a trend of everybody wants to eat sushi suddenly. Okay, and all this while you may have not eaten sushi, but during chemotherapy, I feel like eating sushi. Don't eat sushi because this is a raw food. So don't eat, salmon which is uncooked. Don't eat food that is uncooked. Why? You can eat fish, but bake it well, cook it well, okay? Fry it well, and then you eat. Remember, even the person who's preparing food should wash their hands thoroughly before preparation and even at the time of service. The fruits should be cleaned properly, the vegetables should be cleaned properly. If there are some of my patients who are very, very particular, they say, no, I want to have only very clean, I will wash it in potassium permanganate. Or then there is a Suma tab, tablet that we give from Johnson's Diversey. Okay, I tell them, okay, you want to soak your food, fruits and vegetables in salt and vinegar, all these things. Go ahead and just keep it clean. Okay, if you are in doubt, but keep it clean, or just run it through a nice fresh water under the tap and cut it immediately and eat. That is the way you have to eat fresh foods and vegetables. Do not cut your cucumber or your salad and store it in the refrigerator and eat it after 2 hours. Do not do that. Cut it, keep your boards clean, your knives clean, cut it and eat it immediately. Okay, so that is an important aspect, especially because you do not want to risk any infection because of your immune compromised status. Also, sometimes you may feel that I can eat spicy food. It may just worsen your acid reflux. So tell them that for at least during the chemotherapy phase, do not eat too much oily or greasy foods because that will not, you won't digest it properly, and then that will remain in your stomach for a long time, which will produce a lot of gas and acidity. Also, what you need to tell them to avoid besides hygiene is highly processed foods, which have got lots and lots of preservatives, lots and lots of sodium, lots and lots of colors, sugar, oils, different types of oils that they are using. This needs to be avoided. The other thing that needs to be avoided is alcohol or any kind of a substance that could worsen your situation. Okay, so these things need to be avoided. There's a long list. You go on any of the sites, you will get rare cooked meats, raw vegetables, unpasteurized dairy. Wash and peel your fruits and vegetables. Do not have too much of caffeine. A little bit, 1 cup tea coffee is fine. You don't need to stop everything. But be in normal limits. So what I tell them is be normal. Why do you have to go out of your way? Be normal, be clean, eat fresh food, and eat home food. So that is the way they are able to, help in their recovery. Also, how the plate should look. It should look clean, it should look hygienic, and it should look balanced. So we all know what a balanced tray should look like with complex carbs, etc. Okay. Now we know patient is not alone. We are a part of the patient because we are in the team. We are responsible for the patient's care. It is not only the caregiver who's at home, but it's also the dietitian, the doctor, the medical oncologist. Okay, so your role as a healthcare provider is very, very important here, and work as a team. They may need to contact you in between, show them and tell them how they can contact you. So the quality of life here is very important. Also, there are certain practical strategies which will help, them in cooking and eating, because not all of them can prepare fresh and eat. So some people are staying by themselves. They are staying alone. They don't have help. So how they can make soups or stews or dal or khichdi, which could be kept, and how to freeze it, how to thaw it. The methods could be taught to them. How to manage metallic taste. How to they can use glassware. Okay, do not use microwave. Do not use plastics in the microwave. All these tips you can make like a sheet and you can give it to them so that they know what is the right things that they are doing while preparing the meal. Also, with supplements become necessary. So the most important here is proteins. Okay, if they are not able to eat proteins through food, then you can give a protein source which gives them a little bit of energy as well. Also check if their vitamin D, B12, iron is fine. Some patients require zinc and folic acid. Some patients require glutamine. Probiotic only from natural sources. Do not give any probiotic medications or any probiotic supplements in this case. Food first should be the motto for a chemo patient rather than supplement first. So remember, food first attitude, and therefore nutrition is very, very important in these patients. Also, sometimes things differ with the cancer type, but like if the head and neck cancer requires more aggressive approaches towards nutrition compared to a breast cancer or any other cancer, but a GI cancer requires more aggressive nutritional thought processes. Also, that you have to look at it from an overall perspective rather than only a single. So, whether it is gastrointestinal tract, immune system, musculoskeletal, or any other, you never know, because see what happens is chemotherapy patient may not only have cancer, they may have also renal disorders, they may have CLD, they'll have other problems, other medical issues. So you have to do a combination with their other medical issues as well. Okay, definitely you need to ask them to avoid street foods or foods that are unhygienically cooked. Okay, these are some of the tips you can tell them of how they can include high biological value protein in their foods. What is a first class protein? What is the foods that are anti-inflammatory, whether it's, moringa or drumstick, spinach, beetroot, carrots, pumpkin, and how they can make their diet more basic. Also, sometimes ginger water or, jeera ajwain water helps. Green tea also could help, adding it in that. They could have a sattu drink, that is, you can also make ARF and you add ghee or, a little bit of olive oil or avo oil, whichever is available. Do not go out of the way. Remember, it has to be budget friendly as well. And then, okay, now when we talk about food first, there are certain nutrients which you need to give a supplement first, because vitamin D you do not get adequately from food, nor you may get it from your sunlight. Okay, so vitamin D you will need to give through a supplement. Some patients may have anemia because of bone marrow suppression, GI bleeding, poor absorption. So iron may be one of the supplements, or folic acid could be one which you need to give. There are people who do not eat any kind of fish, or they do not eat omega rich foods, so they could be given as supplements. Also, if you want to add a little bit of zinc, thinking that okay, a person who complains especially of metallic taste in their mouth, for them zinc, elemental zinc, about 15 to 30 mg per day could be useful for a little while. So whenever you're starting antioxidants or a supplement, what you need to do is, first of all, tell the patient, do not self-prescribe. Okay, it has to be prescribed by your healthcare provider. So there are many trials which happen. So the SELECT trial showed that increase in cancer risk, and you cannot overly give supplements, especially this St. John's wort, which is absolutely contraindicated because it has got protein enzyme inducer, that is CYP3A4, that is P glycoproteins. Also, they can reduce chemotherapy drug levels by almost 40 to 50%. Also, certain Ayurvedic products which we are not sure of. Patients will come to you and ask you, see, you're not an Ayurvedic specialist, so why do you want to prescribe? They will ask you, can I have ashwagandha, or can I have giloy, noni juice, wheatgrass? Now, although you can give wheatgrass, but what happens is, how is it made, where it is prepared, what is the hygiene levels of it? Is there a gastrointestinal tract bleeding already, which will aggravate it? So, you have to look at it in totality, even whilst giving, things like noni and etc., which could be hepatotoxic as well. Also, the people will ask you, okay, what about haldi? Is it safe? Now we have seen many trials where putting haldi in food is fine, okay, but you do not give supplements which have got concentrates. Okay, do not give turmeric concentrates. You give turmeric, or sorry, turmeric extracts. You do not give turmeric extracts, but you can add haldi to food very safely. Ask them to increase the way they are eating haldi in the food rather than giving them extracts which are very, very high doses. Okay, so add in your healthy and in your in your vegetables, in your dals, in etc. Okay, so even extracts, like when we say okay, you can bring green tea, but do not give green tea extract, that is the EGCG. Okay, because it reduces the bortezomib efficacy. Do not give like anticoagulants. So garlic supplements, they are anticoagulants. Do not give such kind of a thing. But if they want to add garlic in their food, that can be given. So just remember, although certain foods are safe in their original state, they could be unsafe when they are in the extract or in a supplement state. Also, glutamine in post, is actually we know that glutamine is the most abundant free amino acid in the muscle, and normally body makes glutamine, but it is also called conditionally essential. So sometimes the gut mucosa integrity, that is glutamine, feeds the cell lining in the intestine, and when the chemotherapy damages the cell rapidly, the glutamine gets depleted, and therefore this also could lead to mucositis, leaky gut, okay, bacterial translocation. So glutamine supplementation helps to protect this barrier. So when you're talking about supplementation and when you're talking about giving glutamine can be given. Okay, so the immune cell fuels, that is the lymphocyte, macrophages, neutrophils, they all depend upon glutamine. So when we talk about glutamine, you are not only talking about giving it because it is conditionally required amino acid, but it is also fueling. It is a fuel for your immune system, and therefore, without the immune system recovery, there is delay and then hence risk of infection. Also, the nitrogen transport, that is glutamine shuttles nitrogen safely between the tissues and maintaining the acid-base balance. Okay, so it is basically an antioxidant precursor. That is, glutamine builds glutathione, and it is the body's master antioxidant. So glutathione is from the glutamine builds the glutathione, and therefore you can give glutamine, because even ESPEN guidelines, they support that in severe mucositis, glutamine can be given. Now, how much will you give? You can divide the doses from 10 to 30 grams per day, divided maybe for 7 days, 10 days, or during the state of mucositis, so that it can be given then. Also coming to the food and drug interaction. Now, this is very, very important aspect, because what is chemotherapy? Chemotherapy is basically what you are giving is the drugs into the system of the individual to destroy the cancer cells. So whether it is capecitabine or it is the methotrexate, okay, where you need to give, when there's methotrexate, dairy and folic acid rich foods could interfere at that same time. So do not give at the same time. Even the other, medications like grapefruit cannot be given because of the cyclophosphamide and star fruit. These cannot be given to them at all, because this inhibits the CYP3A4 and it increases the toxic metabolites. So hence, grapefruit and star fruit are an absolute no. For tamoxifen, that is, do not give soy isoflavone supplements. Okay. Although soya can be given, but isoflavone supplements cannot be given. Also, the imatinib, which is you can take, with the meals to avoid. Now, the St. John's broth, which needs to be avoided because again it reduces the drug level, the drug efficacy up to 30%. Then there is the other drugs which can interfere with. So when you're giving chemotherapy, the food and drug interaction is important, and food and supplement and drug and supplement interaction is important to understand. Also, there could be a drug nutrient interaction, which could be even, very, very deep, and therefore monitoring, because whether it's methotrexate or leucovorin, which is important, here the long-term use can lead to steroid, diabetes or osteoporosis. So these drugs are could interfere or could lead to other issues. So of course, nowadays a lot of work is done on CoQ10 or L-carnosine. So vincristine basically can cause neuropathy or constipation, and gradually, therefore, in these cases, people, you can give a little bit of fiber either from an isabgol, oats, papaya, So this is important. Also, pediatric patients is a whole different ball game. We will be talking a lot on the growth, but the only one thing which I would want you to remember for pediatric patients is that their unique growth challenges have to be taken care of. Also, their assessments are very different from adult assessment. You have to use the WHO growth charts, the IAP growth charts, check their MUAC, the SGNA can be seen, their energy requirements are very different. Then coming to other considerations, I will, just now probably end this talk, with a little bit of this thing. But remember that managing common side effects are very, very important. Also, weight management and sarcopenia, there is a dual challenge here where, the patient could be sarcopenic and could lose a lot of weight because of lack of protein in diet. Remember to follow the food safety protocols. Also, common nutritional myths. I thought I will just cover this a little bit because everybody comes to me and tells me, oh, should I remove all carbohydrates from my diet? Sugar feeds cancer. Okay. So, although we do not encourage people to eat sugar, but we do encourage them to have a complex carbohydrate diet because not all carbohydrates should be removed from the diet. Avoid excessive sugar, which is unreasonable for health. But somebody who has not had any food and wants to have, say, a cup of tea with a little bit sugar, that's fine. You have to be practical to explain to the patient what needs to be had and what doesn't need to be had. Yes, the Warburg's effect does explain the cancer cell metabolism. You do get a chance, just read the Warburg's effect, which will talk about the sugar and the elimination of sugar, but not elimination of all carbs. Okay, you have to tell the patients that not all non-vegetarian foods they cause cancer. So they stop all non-vegetarian foods, but then here you have to tell them processed meats which have got high nitrates and nitrosamines. Those have to be stopped. Do not eat raw foods. Okay, then somebody will come to you and tell you, oh, alkaline diets cure cancer. Can I have alkaline water? See, we all understand that the body maintains a blood pH between 7.35 and 7.45. So whatever you do, the blood pH will be maintained. No food and water can change the blood pH. However, when we talk about alkaline diet, we talk about eating good amount of fruits and vegetables because of the alkaline ash that is produced. Okay, so it does not alkalize the blood per se. And dairy does not cause cancer, so it gives you a lot of calcium, vitamin D. If you're very fussy about it, then try to have an organic dairy, and where you can have curd, paneer, buttermilk, these are fine. Yes, in a neutrophilic phase, we do avoid, certain amount of fermented foods only when there is neutropenia, but not for normal chemotherapy. Also, the nutrition screening is important because, the screening is the first step towards actually finding where your patient is. So please do screen all your patients thoroughly. Make this is a simple plan which can be made for them. These are some of the inspiring stories, where people come to you and they tell you that, we have benefited following a diet, following guidance from the dietitian, and we benefited there. Also, empowering strength through nutrition is very, very important because build strength, immunity, muscles for these patients. These are some of the key takeaways where I would say screen every patient, individualize them. All, not one size will fit all. Okay, know about pharmacology a little bit, understand blood sugars. Okay, do not unnecessarily start new things like new supplements or new herbs. Use a lot of your cooking strategies which will help you. Thank you for this patient listening and understanding. If you need to contact me, I'm available, and I thank the Academy of Nutritional Sciences for their valuable support for this presentation. If you need any of my books, whether it is for dysphagia, transplant, or vegan books, it's available either on Amazon, or the print copy is available very easily. But if you want specifically, you can get in touch with me. And please do follow me and follow Academy of Nutritional Sciences, because a lot of updates do come here as to what we are going to do next. In fact, we're having a critical care nutrition series coming up very soon. Please do join that. Yeah, thank you.
Okay. Yes, I see a lot of questions in the chat box. So whilst I take some questions, if you all have some more questions, you all can ask me. Okay, so so Sohini Mahajan has asked that one of my post-chemo patient, the oncologist is not ready to supplement any vitamins. Presently, the patient is very severely nauseous and low on intake. Her CRP is a little higher and homocysteine is high. I'm in a fix as the patient has a lot of vomiting. Okay, so first of all, Sohini, what you have to take care of the vomiting. Vomiting can be taken care of by, giving certain guidelines or strategies for the patient. So avoid the food the patient feels nauseous with, especially smells. Give the patient small, easy to digest food and easy foods to eat. Supplements will not help the vomiting in any ways. And sometimes, if the oncologist has not allowed you to give any supplements, I think go with the oncologist. There, as I said, there are some interactions sometimes of drug-drug interactions and drug-nutrient interactions as well. Even when I am giving a supplement, I tell the patients not to take a supplement on the chemo days. Okay, because there's already a lot of medication, a lot of drugs that are entering into the system of the patient. And on over and above, if you're giving vitamins, minerals at that same time, it could have a interaction. So in order for that, I tell them to have the supplements that are required if there is a deficiency on non-chemotherapy days. Also, the fact that CRP is high, it means that the patient has got inflammation and infection, or some kind of inflammation from somewhere which needs to be taken care of. Treat the vomiting with small frequent meals, easy to eat, digesting foods. Patients' likes, dislikes can be considered. Do you suggest, Sakshi has asked, do you suggest fasting before chemo session? Not required. Fasting is just not required for any patient. Please, they can eat normal food. Even during chemotherapy, they can eat. So no need to fast. Is a low FODMAP correct approach to high hemicolectomy patients? Okay, so now hemicolectomy is a different medical condition, and a low FODMAP diet is given for a different medical condition. Now, however, if a patient has got hemicolectomy, you have to give a low residue diet. Now, today, whoever PS is, today we are not talking about that diets. We will have another session on low FODMAP diet and hemicolectomy. However, if the patient is on chemotherapy, follow the chemotherapy procedures. What kind of supplements are safe for giving? Now, first of all, when do you give a supplement? You give a supplement when the patient is deficient. What the patient will be deficient in? The first thing, check for protein. If the patient is deficient in protein, if they are not eating adequate protein throughout the day, give protein supplement. Okay. If the patient is losing excessive weight or muscle, then you give a protein supplement which has got calories as well. If the patient has not checked his vitamin D and is vitamin D deficient, then give vitamin D with a fat rich with a meal. So give the supplement based on what assessment you have done for your supplement. So when you do assessment, you do a calorie, protein, fat, vitamin, mineral supplement and assessment, and then you give the supplement. Okay. Uh, Thank you, Purnima, for acknowledging the tips. Thank you, Shruti. Also, Cheryl, thank you. You would ask, yes, I didn't cover exercise. Very important question, Cheryl, because uh, when a person is doing chemotherapy, they have a lot of weakness and they don't, the lethargy, they don't feel like exercising. But exercise is definitely important to maintain the muscle mass because they could be even sarcopenic. So all these things, even if they cannot do heavy exercises, they can do light walks, they can do stretches, they can do certain exercise which are allowed for them. And exercise is important. Mhm. Yeah, I'm getting a prompt saying that you can join a rehab session as well. So, yeah, that's my rehab dietitian telling me, yeah, send her to the rehab. So, of course, there is a rehabilitation unit in our hospital. We have rehabs for post chemo or during chemo, where they do certain exercise guided by a physiotherapist. Yeah, thank you, Satwa. Sujata says that, can you suggest a good brand of vegan? Yes, I use a rice protein from called the Oraze protein. I can share with you the link on the website here. If you do not get the link and and you're having a problem in finding a vegan protein, I use Oraze because it has no preservatives, it has no color, it has no flavor. If you taste it, it really doesn't taste good because it does not have any additions. Okay, and therefore I try to use clean proteins for my patients. So when a patient is vegan, I give them recipes. I also have a vegan recipe book, which is available free. I can send that to you if you send me a WhatsApp message. And so vegan rice proteins we are using, and I can share that details with you. Yeah, thank you, Jayashri. Okay, post-chemo radiation and years of recovery, mouth cancer patients are often noticed to have swallowing difficulties. Absolutely. If there's a head and neck cancer, they do have swallowing difficulties. The first thing that needs to be done is check with a swallowing therapist, with a SLP, whether the swallowing is safe. Okay, gives wave swallowing methods. If you read my book on dysphagia and swallowing difficulties, you will get a little more insight on it. It is available very reasonable on Kindle. If you want a hard copy, message me or get it from Amazon is also it's available. Okay, then can we advise keto diet for few patients asking if they were to follow previously? I would say that keto diet has to be given in a very safe environment, and it's not very advisable to give a keto diet to a person who's already losing weight because it has to be well calculated and given it in a proper manner. So if you have to give a keto diet, just give it very scientifically. calculating the total energy requirements, protein requirements, and then only it can be given. So it is a difficult diet to give in chemotherapy. However, if you want, we can discuss in future um, sessions about ketogenic diet for cancer therapies. Yeah, that is an entire big topic by itself. Okay. Yes, Rashida. Hi, I know that yes, you did the cancer nutrition course at BMN, and I'm hoping that you're following some of that. And thank you, Swati. Yeah, that's the this thing, and thank you all of them for listening to my sessions. And I'm hoping there are no more questions. So if there are any more questions further, I'm always available. Just send a message to me, and I will reply to them.
Thank you so much, ma'am.
Yes, thank you, Molita.
It was really good. On behalf of the Goa College of Home Science and the Nutrition Society of India, Goa chapter, it is my privilege to propose this vote of thanks. I extend a sincere and heartfelt thank you to Dr. Eileen Canday. We are grateful for your expert insights you have shared regarding the critical role of nutrition after chemotherapy. Ma'am, your guidance on managing chemotherapy side effects, importance of phytochemicals, the natural remedies that we can give our patients, and avoiding highly processed foods. Uh, it was really insightful. Thank you so much, ma'am. I would also like to thank all our participants for your active presence and engagement. It has been vital to the success of this session. Thank you once again to everyone who contributed to making this session a resounding success. Thank you.
Thanks, Monita. Thanks, Varsha. And anytime you need a session, just let me know. I'll be very happy to deliver.
Yeah, thank you, Dr. Eileen, for even allowing us to use the Zoom platform
Yeah, most
and
welcome. Anytime.
collaborating with us. Yeah,
Anytime.
thank you so
Anytime.
much.
Yeah, and take care of your voice and sound.
Thank you,
Thank you,
Molita,
ma'am.
for
Yeah,
coordinating the session. Yeah,
thank you,
thank
ma'am.
you.